Thank you very much. Um, Dr. Cohen, may I proceed to take the vote?
Yes. So before we proceed with the vote, I just want to remind all the members to please have their videos on. Give us 1 second. We're going to change the view. We also want to remind all members that we will do both sets of votes, and then we will provide each member an opportunity to make a statement explaining their vote after the vote has concluded.
Thank you very much. For the public, again, I wish to note that 3 voting members have indicated conflicts and will not be issuing a vote. However, I will ask the 3 voting members, when I call your name, to please state that you recuse yourself. Excuse me, I'm sorry. That you recuse yourself. All right. So I will begin calling the roll alphabetically with your chair last. And begin with Dr. Robert Atmar. Dr. Atmar, how do you vote?
Atmar, recuse.
Thank you, sir. Ms. Lynn Bata.
Yes.
Dr. Beth Bell.
Bell? Yes.
I believe I did something out of order here. I should have read the vote. Forgive my error on that. Let me read that vote, the item to be voted on, and then we'll restate the votes. Excuse the error by your chair. So to begin, the question at hand is as follows. The Pfizer-BioNTech COVID-19 vaccine is recommended for persons 16 years of age and older in the U.S. population under the FDA's emergency use authorization. So we will now vote on this, and I will start from the top again. Forgive me. Dr. Kevin Alt.
Alt, yes.
Thank you. Dr. Atmar.
Atmar, recuse.
Ms. Bata.
Bata, yes.
Dr. Bell.
Bell, yes.
Dr. Bernstein.
Bernstein, yes.
Dr. Fry.
Fry, recuse.
Dr. Hunter.
Hunter, recuse.
Dr. Lee.
Lee, yes.
Ms. McNally.
McNally, yes.
Dr. Paling.
Paling, yes.
Dr. Sanchez.
Sanchez, yes.
Dr. Szilagyi.
Szilagyi, yes.
Dr. Talbot.
Talbot, yes.
Romero, yes. Dr. Cohn, the vote is 11 in favor, 3 recused. The motion passes. Next motion, please.
Dr. Romero, I concur with your count, and I want to remind the voting members that on the schedule amendment, all members can vote.
So again, I will read the motion, and we will start alphabetically. And as Dr. Cohen has pointed out, all members may vote. So the motion: recommend the proposed amendment to the 2021 adult and child adolescent immunization schedules. We will begin. Dr. Atmar.
Atmar, yes.
Dr. Alt.
Alt, yes.
Dr. Bata.
Bata, yes.
Excuse me, Miss Bata. Dr. Bell.
Bell, yes.
Dr. Bernstein.
Bernstein, yes.
Dr. Fry.
Fry, yes.
Dr. Hunter,
Hunter, yes.
Dr. Lee,
Lee, yes.
Ms. McNally,
McNally, yes.
Dr. Paling,
Paling, yes.
Dr. Sanchez,
Sanchez, yes.
Dr. Szilagyi,
Szilagyi, yes.
Dr. Talbot,
Talbot, yes.
Romero, yes. Dr. Cohn, we have 14 votes in favor, none opposed, none recused. The motion passes.
Yes, I concur. The motion passes.
Thank you all very much for that vote. We'll now open it up to comments from the members of the ACIP, the voting members of the ACIP. Please go forward, whoever wishes. And I'm sorry, let me just pull the list over.
Give us just a second.
Okay. I see Dr. Talbot is first
Yeah.
on the list.
Yeah, I just wanted to say thank you to all the incredible civil servants who have worked tirelessly to make this happen. This is our first kind of big break in this epidemic, and many of our civil servants at both the CDC, the FDA, and the states have been working crazy hours with no extra pay, all to make this U.S. a better place. And I just want to say thank you from the bottom of my heart.
Thank you, Dr. Talbot. Dr. Szilagyi, please.
Yes. First, I wanted to give a really big thank you to everybody who's on this video, to the ACIP voting members, to the liaisons and affiliated organizations whom I so admire. And I really wanted to thank the CDC work group, the COVID work group, the CDC leaders, and the thousands of people at CDC who are working on this pandemic and on the vaccine. I want to say that I voted for the vaccine because of the clear evidence of its efficacy, safety profile, and benefit risk profile based on our evidence to policy framework. I wanted to emphasize that this recommendation is within the context of our prior phased allocation recommendation. And as a pediatrician, I wanted to say strongly that I felt 16 to 17-year-olds should be included in the routine vaccine recommendation for COVID, in the COVID vaccine recommendation, because of the risks from the disease and the lack of any evidence to suggest that the efficacy or safety profile should be different for 16 to 17-year-olds than for 18 to 25-year-olds. I also wanted to reemphasize what many people and I have said today for the need for substantially increased government funding to actually implement the recommendation. So this is government funding to state and local public health organizations, and also funding to health systems and health providers. So I know we're going to have very tough and sad times ahead because of the surge in a limited vaccine supply, but I am really hopeful that this is the beginning of the end of the coronavirus pandemic. Thank you.
Thank you very much here. Dr. Bell has brought something to my attention, and I want to be sure that that something was not amiss. So, Dr. Alt, did I happen to skip you on the vote, sir?
You skipped me because you didn't read the vote, but I voted yes for both proposals.
Okay.
You got me the second time around, so I got to vote. I'm happy.
I'm sorry. Forgive me. Dr. Cohen, do we need to do anything to go back and amend that so that there is no doubt about this vote?
We're good, Dr. Romero.